When it is said to be heart attack, conditions causing heart attack ischemia, atherosclerosis, formation of blockages. When discussing heart attacks, it's essential to understand the role of coronary arteries and how blockages can lead to this serious condition. Coronary arteries. The heart is a muscular organ that requires a constant supply of oxygen-rich blood to function properly. This supply is delivered by the coronary arteries, which encircle the heart and provide oxygenated blood to its various regions. Coronary arteries are essential for maintaining the health and functionality of the heart muscle. When these arteries become narrowed or blocked, the heart may not receive an adequate supply of oxygen and nutrients, leading to a condition known as ischemia. Atherosclerosis. 1. The most common cause of blockages in coronary arteries is atherosclerosis, a condition characterized by the buildup of plaque inside the arteries. Plaque is made up of various substances, including cholesterol, calcium, and inflammatory cells. Over time, plaque deposits can narrow the coronary arteries, reducing blood flow to the heart. This narrowing process is often referred to as coronary artery disease, CAD. Atherosclerosis is a gradual process that can begin in childhood and progress over many years. Risk factors such as high cholesterol, high blood pressure, smoking, diabetes, and a sedentary lifestyle can accelerate the development of plaque. Formation of blockages. As plaque accumulates within the coronary arteries, it can eventually lead to partial or complete blockages. 1. When an artery becomes more than 70–80% blocked, it significantly impairs blood flow to the heart muscle. At rest, the heart may still receive enough blood to meet its needs. 2. However, during periods of increased demand, such as physical exertion or emotional stress, the narrowed arteries may fail to supply adequate oxygen-rich blood to the heart muscle. This imbalance between oxygen supply and demand can result in symptoms such as chest pain or discomfort, known as angina. 3. If the blockage becomes severe or complete, it can lead to a heart attack. Heart attack, myocardial infarction. A heart attack occurs when blood flow to a part of the heart muscle is severely reduced or completely cut off due to a blocked coronary artery. Without a sufficient blood supply, the affected portion of the heart muscle begins to suffer from ischemia, lack of oxygen. If blood flow is not restored quickly, the ischemic tissue can become damaged or die. This irreversible damage to the heart muscle is known as a myocardial infarction, MI, commonly referred to as a heart attack. The severity of a heart attack can vary depending on factors such as the size of the blocked artery, the extent of the blockage, and the duration of reduced blood flow. Prompt medical treatment is essential to minimize damage and improve outcomes. Most heart attacks are seen in men compared to female. The blockage build takes usually time. It may take up to 7 to 10 years. If it is a minor attack, a small portion of hair muscle is dead where the blood supply not completely blocked. Major ATCAT is that major portion of the heart is dead where there is no blood supply. Best diagnostic test for blockage in coronary artery is CT anagram, then ECG. ECG indicates when there is 80–90% block is there in coronary, when rate and rhyme of heart changes that during rest position of patient. CT computerized tomography coronary angiogram is imaging tests that looks at arteries that supply blood to heart. It uses powerful X-rays machine to produce the images of heart and its blood vessels. It's better to undergo every 1 year or 6 months CT coronary angiogram as screening. If patients undergoing for this test, kidney function should be proper because a small dye injections into the body. This test indicates even small 10 to 20% block in coronary arteries. Non-veg diet contains cholesterol, whereas all cooking oils from the plant's extracts contain triglycerides, which also dangerous to heart. What is triglycerides? Triglycerides are a type fat, lipid present in our blood. Triglycerides are stored in your fat cell. Later hormones release triglycerides for energy between meals. There is an Indian doctor named Dr. Bimal Chajera. He made many cooking recipes without using oil. Dr. Bimal Chajera were helping public in making the zero oil diet. Many recipes were made and posted in his YouTube channel. In India, 35 lakhs people die by heart attack every year. That is 9,000 people every day. Every one patient for 10 seconds. There's a community Seventh-day Adventist church. They are pure vegans. Even they don't take milk and their related products. So many clinical studies were done on them. They had least heart attacks in the world. In Finland, there was a research done on South Carolina by cutting down milk and their realted products and smoking reduced the coronary artery blockage a lot. American doctor named Dr. Dean Ornish has written a book, Reversing Heart Disease. In his studies, intensive lifestyle changes for reversal of coronary heart disease conducted on a patient of 48 patients with moderate to severe coronary heart disease with a follow-up 5 years time period. Conclusion of the study states that comprehensive lifestyle changes a period of 5 years, that coronary artery stenosis is decreased. Lancet is the first journal club to publish that blockages can be reversed. LDL low-density lipoprotein is a bad cholesterol makes up most of your body. Cholesterol raises your risk for heart diseases and stroke. HDL high-density lipoprotein is a good cholesterol. It absorbs the cholesterol in the blood and carries back to liver. The liver flushes it from the body. High levels of HDL cholesterol can lower risk for heart diseases and stroke. Eggs also contain high cholesterol, mainly yellow part. The white part is good as it contains protein. Lifestyle changes need to increase productivity of heart. Stop intake of any form of oil. Stop intake of milk and their related products. Brick walking for 35 minutes every day decreases the chances of ischemic heart diseases. Taking less stress in everyday work. Stop smoking and alcohol for a smoker. Alcohol increases the number of cigarettes. This correlation is directly related. Stop intake of non-vegetarian diet. Many studies states that vegans has lower incidence of ischemic heart disease. Doctors advises that if patient with risk of ischemic heart disease, carrying 3 tablets togetherly of atorvastatin, 80 mg 1 tablet, Dispirin, 325 mg 1 tablet, clopidogrel, 75 mg 2 tablets, help them in case of emergency.